Dr. Lucia Anelich from Pretoria. Dr. Anelich, thank you so much for joining us. Now, how bad is the situation?
Well, I mean, we have 948 cases which have been confirmed and 180 deaths. And way back in January, I made a statement saying that this was the worst documented listeriosis outbreak in the history. And that is, in fact, the case.
Now, Doctor, who are people likely to be infected or to get sick from listeriosis?
Well, there are two forms of listeriosis. The mild form can strike anybody, including healthy individuals. That is caused usually, the symptoms of fever and diarrhea, tummy pains, that kind of symptom. It passes quite quickly, and most people won't even know they were actually infected with listeria. But the vulnerable sector of the population is actually at higher risk, and that's the grouping that can actually get the more serious form of listeriosis, and that is when it moves out of the intestine into the blood system and gets to the liver and other organs and the cerebrospinal fluid as well. And our vulnerable sectors that I've mentioned are the pregnant women, people over the age of 65 years, and also people with weakened immune systems.
Dr. Anelich, what's the incubation period when it comes to listeriosis? There have been different indications. Some experts are saying it's about 1 to 3 weeks, and others are saying it's up to 70 days of incubation period.
Yes.
Just take us through the process of how long it takes to have listeriosis and to really see the effects of it.
Generally, it's between 1 and 4 weeks, but it can be as soon as 3 days after the food has been ingested that was contaminated, and it can take as long as 70 days before symptoms will actually appear. So this will be influenced by, for example, the susceptibility of the individual, the dosage of the organism, the amount of food you eat, so food portion, and also frequency of eating that food, if you're eating it 2 or 3 times a day, or you're eating it maybe once or twice a week. So all of that plays a role.
You addressed a food workshop recently, and where you broke down the different strains of Listeria. Which strains are very common? You mentioned 10. Which one is the most common out of the 10 that you discussed at the workshop?
Well, the one that's the most common that is currently affecting us here in South Africa is the so-called ST6 strain. And because it has been found in 91% of the confirmed cases, it has become regarded as the so-called outbreak strain. So that is typically the strain that we would be looking for.
There's also been, just going abroad, where we've seen 2 patients, or was it 2 cases of listeriosis in Australia. What sort of strain are they dealing with there?
I'm not sure exactly what the strain is, but I do know that it's not the ST6 strain. And in fact, there are 15 people that have taken ill, and 3 have died thus far in Australia. And it's actually affecting the elderly in that country, whereas our listeriosis outbreak is affecting mainly the neonates, children younger than 28 days old.
Dr. Anelich, we've seen the reaction from the public. There's been hysteria, people trying to get rid of their product, and you know, we saw earlier in the clips where at the Enterprise factory outlets where people were losing patience and wanting to get their refunds and getting their product which they bought from the factory shop back into the factory. Now, ways of storing raw food in the fridges as well as cooked food in the fridge, because there was mention of the packaging of some of the product having also been contaminated. Just take us through that process and just give us information on how to do storage the correct way.
The best way to do storage in your refrigerator is to separate the different kinds of foods. And also all raw meats, in particular, where they could drip juices, they must be stored at the bottom of the refrigerator. and any other raw product that you would eat raw without cooking, such as some vegetables, for example, they need to be kept right at the top of the refrigerator so that there's no cross-contamination from the raw meat to a food that you would eat without cooking it first.
Let's speak about the identification of Listeria or listeriosis. Why did it take so long for it to be identified and to make sure that the word is out there to the public?
Well, I think there are various factors that have actually played a role in this particular outbreak. First of all, the NICD has been monitoring listeriosis in South Africa way back since 2013. And on an annual basis, there have been around 60 to 80 cases. And it was on the 1st of January, or since the 1st of January 2017, that they started to see a spike in the number of cases. And that is when the alarm or the alert was raised by the NICD that, in fact, this is not something that that should be left alone. It should definitely be addressed. And that is when the Minister of Health went public on the 5th of December last year, when we already had 550 cases and 36 deaths.
And with regards to that, what sort of process is used with in terms of testing for Listeria or listeriosis?
Well, the first thing that you do in a patient is you take a sample of the blood or the cerebrospinal fluid, and that is sent off for testing. With food, you take a sample of the food or a variety of samples usually, and the best is to use a specific sampling plan that can statistically give you the reassurance that you've tested enough products to get a pretty conclusive answer. And that goes to a laboratory, and there are ISO methods, which are standardized methods across the world that are used to isolate the organism in the laboratory.
Speaking of across the world, some countries have come out and already banned processed meat products from South Africa. Is this necessary?
Well, yes, specifically if it's coming from the mentioned factories in South Africa. And I do know that the retailers as well as the manufacturers that are implicated have conducted a recall of products in Africa.
Dr. Anelich, very quickly in wrapping up, we seemingly all know that in dealing with whether bacteria or anything in food product, raw product needs to be cooked to deal with any bacteria. Is this a possibility with listeriosis? Can you cook product to ensure that it doesn't have listeriosis? What are the ways going forward? Should people just get rid of the product altogether?
Well, it depends on the product. Processed meat, if it is already contaminated and it's not usually cooked before eating, like polony, that would be something that should be avoided completely. However, things like Russians and Frankfurters and Viennas, they can certainly be heated before eating. And if they are reheated, this must be at a minimum of 70 degrees Celsius, so that you have a steaming hot product that is thoroughly heated to the core of the product, and that would kill Listeria, because Listeria luckily is easily killed by cooking. So even cooking raw chicken, raw meat, it's all good. It will get rid of Listeria.
Dr. Anelich, thank you so much for joining us. We'll leave it there for now. That was Dr. Lucia Anelich, an international food safety expert, and she weighed in on the listeriosis outbreak making headlines.